These colleagues gave us commitment in the appointments committee, and they have reinforced that commitment when they took oath that they are going to serve diligently, observe the law, and as we promised then, we promise now, we are going to hold you accountable to that and to the oath that you have taken. Mr. Speaker, you made a very critical remark and asked them to be present in the House. In the past, we have had challenges where we look for particular ministers and they are absent. We have questions from both sides of the House, and ministers are not present. And so the government chief whip, see her running around, making calls, trying to get hold of them. So please make your whips work easy and be available to respond to this question. Sometimes, by the way, an unsatisfactory response is better than no response at all. Yes, that we ask a question, you give a response, we are dissatisfied, and then we can quarrel about the response. But at least there's a response. But it's more problematic when there is no response at all. So we remain in abeyance, but we hope that you will live to the oath that you have taken. Mr. Speaker, I have severally raised something, and the House has asked government to follow up. I'm glad the Minister of Health is here. Again, I want to appreciate the government chief whip. The issues we raise, she follows up. She writes, I get a copy that this matter was raised, so she writes to the relevant minister asking them to follow up. That's a good thing that should keep happening. So that then we are able to keep track. So one of those issues was about medical interns, Mr. Speaker, that I've raised severally here. Today I received a letter written by the President of Uganda Medical Association. He has written to the Minister of Health, medical doctors, healthcare professionals, key stakeholders, and the general public. So I received this letter in two capacities. As a key stakeholder, because Parliament is a key stakeholder, and as a member of the general public, because indeed I am a member of the general public. Uganda Medical Association is giving a position on the welfare of medical interns. We have asked this question again and again. Government has yet to give us a satisfactory response. So the medical professionals, where they have been posted, it's in this letter. And number two, they are saying if in 14 days government has not addressed the issue of facilitation of medical interns, the doctors, all the doctors, are going to carry out industrial action and lay down their tools. And they're saying throughout the industrial action, only emergency care and essential life-saving services shall remain available. I firstly want to table this letter. I don't know if the Minister of Health has gotten his copy, but me, I've gotten mine as a member of the general public, so I'm laying. The concern, Mr. Speaker, is when this issue is not being addressed by government consistently, we get a problem. Because medical interns were posted. Many have not reported to their postings. Why they are saying they don't even have transport to get them there. They need resources to rent where they will be staying, for feeding, for transportation, because many will not be staying very close to the health facilities. And these people are saying they are not students. They are medical doctors who are now on practice for the 1 year that is mandatory. That's their argument. As I mentioned the other day, the Minister of Health was not around. He has been moving around different health facilities, sometimes in the middle of the night, 2 a.m., 3 a.m., to monitor. And who does he find at these health facilities? It is medical interns who are doing the bulk of the work. And so they're saying, government, why do you not want to value the work that they are doing? But number two, how do we expect them to go and do the heavy lifting? Sometimes they are on their postings for 48 hours non-stop. We need a response to this matter. Now I'm worried when there is a threat of industrial action by all medical workers. And I know, Mr. Speaker, it's easy to say, you medical doctors, be patriotic and report to work. But they are saying, government, be patriotic and pay them for this service. We need a response to this matter, Mr. Speaker.
Thank you.
The last time I gave a response was, I am undertaking consultations. I have a draft statement for Parliament, but I have not concluded all the consultations I need to do. But just in terms of update where we are, this matter is arising from a new policy that has been passed regarding health training, and which affects interns, deployment, welfare, and other aspects. I did meet the interns, the pre-interns, because they are not yet interns. You become an intern when you qualify and report and sign a contract with the management of the hospital where you are doing internship. That's when you become an intern and you have a relationship with the government. At the moment, those who are writing are graduates who have completed their university training. They have passed and their names have been forwarded to the Ministry of Health for deployment. We have indeed deployed them to all the hospitals where internship is done. And the deployment letter was saying you report between the 3rd and the 14th of this month. I did meet the leaders of the pre-interns, about 60 of them, and we had a lengthy and cordial discussion of about 6 hours. It is rare for a minister to accord 6 hours to a group, because we have a lot of work that we do. But I patiently had a discussion with them for 6 hours, and we did agreed that one, yes, we share the concerns regarding the new policy measures regarding their welfare, and I undertook to do consultations, but urged them to report for deployment as the consultations get concluded. I think the challenge that these young people are getting are external forces that advise them, you lay down your tools, you don't report. I must state that the interns need that internship if they are going to practice the professions in which they have trained. Interns, I don't want to sound like insensitive, are not employees of government per se, but internship is a period when you are transiting from being a student to becoming a fully licensed professional. That should be clear. It is also not true that is interns who run healthcare in this country. Yes, they make a contribution, they provide labor as they learn, but the healthcare is provided by different cadres in the health sector. For instance, we have health center 3s, health center 4s, and a number of district hospitals where we don't post interns. Are we saying they are closed? Are not running. For this
6 months, the mortality rate went down. You have said right here that we speak with evidence. Can you please table the evidence?
Now, you see, you asked, you made a ruling, you did.
Mr. Speaker, is he in order to say that the mortality rate reduced to that level? Give the evidence. Give the evidence.
Thank you.
Are you in order?
Honourable Minister, you know when they put you on order, you wait for a ruling. Yes. Yeah. Now, colleagues, that becomes difficult for the Speaker to rule on. Because if the Minister has his facts, okay, based from statistics, so maybe we can ask him to expound on that, to give us more. But I hope our interns are not a danger, okay, are not a danger to our patients and community.
What I am raising on the floor is factual, because I cannot be reckless on the floor of Parliament. But the implication and the meaning of that